folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to use a belt to stretch a tight, painful neck. We figure most people have a belt somewhere in their house.
Sure.
Especially a leather one. They seem to work a little bit better because
Yeah.
they really grip onto the neck. And the whole thing we have found with neck pain, generally the more you can regain motion, the more the pain tends to go down.
Right. Neck pain as well as
With almost
it radiates down to the shoulder
Yeah.
and down to the arm sometimes. That I've had tremendous success with these things.
Exactly. So by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Join us on our social media platforms. We're proud of. We just started on Instagram.
The Graham Cracker
The
channel.
Graham Cracker channel. Facebook. You're going to want to join us there on Bob and Brad because right now, once again, we are giving away a fantastic prize. We're giving away a SleepOvation mattress. This is a great mattress. They have 700 individual mattresses, and they work really well for pressure relief, especially if you're having back pain, neck pain, shoulder pain, hip pain.
There are a wonderful mattress, well over $1,000
Yeah,
value.
both of us use them, and we couldn't say enough about them. So go out there and get your chance to win a free one.
Yep.
So if you, otherwise I think we're ready to go, aren't we?
Yeah, let's go to this.
I think the first thing, is your neck tight?
Right.
So we're going to show you just a couple things you can do. First off, you're going to see, are you tight going into flexion? Most people are not, because
Right.
you spend a lot of your day down like this, looking down at your phone or looking down at the newspaper for the old people.
Right.
But
One
I'm
thing
one
I
of
do
them.
want to say, I think you'll agree with this, and any therapist will probably agree, once you get probably to around that 60-year mark or older, it just seems like people's necks tighten up, their range of motion gets less and less. And I would say for my experience, it's across the board, not 100%, but the majority.
yeah, unless they were super loose in the first place, like they have,
Right.
one of those
Yeah.
ligament diseases where they.
So how to assess it? You can do it by yourself if you're going to use a mirror. It's a lot easier if you have someone else give you some feedback.
Right. But this first one's easy enough. Can you put your chin down to your chest? And like I said, most people are not going to have trouble with this one. In fact, I'm not even showing how to stretch this one, Brad, because it's so.
No, right.
The second one is, you can look in a mirror. You can actually put the mirror right here on your side,
Yeah.
and you turn your head,
Oh, good.
and you can see how close your chin is getting to your shoulder.
Right.
And if you can see on me, actually, this is my tight one.
Right.
I'm not getting all the way back.
See, so if you look at that white spot, that's why I got that white spot on my shoulder today. So you can go like this and there, and then if I rotate this way,
Yeah, I go
I
further
don't,
this way.
I'm losing a little range of motion to my left as well, Bob. So we
Go
can
to your left ones again. Yeah, let me
go
see.
this way.
Oh, you're tight. You're really tight.
Well, Bob, you know.
He's acting like
I'm
I'm so
not
tight.
human.
You're worse than I am.
I'll stretch it out.
All right, we'll stretch it out. And then there's side bending. This is one too. You can kind of look in a mirror. You can even measure with your fingers. How close are you getting to your shoulders? Don't lift your shoulders up like this. You got to leave them relaxed.
Yeah.
And you bend over to the side, and then you compare side to side. And they both could be tight, but generally what we find is one side is tighter than the other, and that's the one you want to start off by focusing on. The last one that we want to check is extension. Brad, you want to show that? You had a good way. You said you take your patients.
Oftentimes I'll go to have the person take a chair back to the wall, and there you'll see the corner. I'll just say lean back, and then see how far you can look up toward the ceiling, and if they have no problem with that. Most people can usually get to the corner, see the corner of the wall, except for older people. People in their 60s and 70s, that usually if they can get up to this point to see the ceiling, that's pretty normal. A lot of times I'll see people get to here, and it's pretty tight by then.
Yeah.
Younger people, or like myself, because I stretch this, and that's fine to get way
You'd be
back to
shocked
see
how
the
far
wall.
back your neck can go, and you really do want to work on that.
As long as it's pain-free.
Right. All right, we're going to show you something here too, just to point out a little piece of anatomy.
Here, Bob, let me
Don't
point it
understand.
out.
Okay. So this is where your head would be. He'd be actually looking at towards Brad here. Now you have two little joints on each level of the neck, each level of the spine, the cervical region. And what we want to point out is the joints are angled like this.
Yeah. So if you look at the blue tape, it's angled this way, and that's the angle of the joints, and when they meet, they're flat joints, it's like your hands rubbing together, they're called facet joints.
But
Like-
they're angled like this.
Right.
So,
In your lower back, they're not so much, it's a different story, but the mechanics here, and that's important for the stretcher we're gonna show you.
right, so next thing is you need a belt. Brad's got a belt,
Yep.
and you just go ahead.
Oh.
This could cause some problems at work if you do this. People are wondering what the heck you're gonna do, but
Yeah, so yeah, just, bring one in your pocket.
when I was a kid, this is a worrisome
Oh,
sign.
yeah, back in the day, you can't do that anymore.
My dad never did hit me with a belt though.
No.
No, he did. One time he took me.
Oh, this showed you.
He took behind the shed and he was gonna do it.
Yeah.
He said, I'm gonna do it just like my dad used to do it, and I talked him out of it. I did.
Wow.
He was a good man.
Yeah,
He
he
was.
was not abusive, yeah.
Anyway, so we're gonna work on extensions first.
Sure.
And the thing is, I like to, again, you can get it on different levels of the neck, but see how I have it angled up here? So it starts low, it angles up to the eyes.
Bob, you talk, I'm gonna take my
Yeah, I was gonna say, it's really hard to do this with the microphone on. But you can go ahead and keep the angle, and while I go back, I'm trying to go back further, the belt is coming along with me. I'm not going like this, the belt goes along with me. You're following the ends of the belt with your eyes. And this can really work, and what's nice about this is you can get different levels of the neck. You can get down really low, and the leather belt grips onto the neck really quite well. And you can also get up into higher levels here.
Right, as a matter of fact, I'm seeing a woman, she's about 40 years old, and I've been working with her for 3 visits. Neck pain, shoulder pain, and mid-back pain, and we're doing this stretch, and when I showed her this, she said, boy, does that make a difference. And this is one of her primary stretches, and she's making significant gains.
Good point, Brad. Now, the other thing that I often will have people do, if let's say they're having pain going down one arm,
Yep.
I might have them grab with the opposite arm, and that's what works out with a belt really nice. It's easy to grab on with one hand.
Yeah, and again, these should feel like a
Good.
good stretch. You're not creating pain. If it's irritating it, your problem is either too severe or maybe it's a different problem, and then you're gonna not do this.
Yeah,
so.
if it sends pain down your arm,
Yeah.
it's not helping the pain come back up and get out of your arm.
Yeah.
It's not the right thing to do.
Or if you get dizzy or lightheaded while you're doing it, then you stop. then
There's
as
a
well.
lot of things that you have to kind of watch here.
It should feel good.
You can do chin tucks with this too, by the way, as a
Sure.
warm-up. I mean, you can just go ahead and grab, and now this one I usually just go straight across, and I do chin tucks, like this. You might start off just by doing chin tucks without the
Yeah.
belt, and then if you want to give a little extra pressure, you can go ahead and use the belt to hit different levels.
It helps, you can stabilize, so you can get different levels, so to speak.
Yeah.
That's a bit of therapy talk, but,
Yeah. All right, let's go to rotations, Brad. So with the rotations, it's a little tricky. What you do is you're gonna have the belt down low like this.
Oh, yeah.
And then you're gonna go ahead and switch arms, because I'm gonna go to the right. I'm gonna take my right arm and grab the left side of the belt, and this one pulls straight down, not across like this. You don't wanna choke yourself off. And you're gonna come across, again, we wanna angle up like the facets or the facets do, or the joints do. So it's going up to the eye, and I'm gonna work on going to the right here.
And again, make sure you're up across the jawbone. If you get down here, then you get across your neck, and then you don't want to have a breathing problem. So get it up in the. This one should also feel like a real nice.
And you can hit,
Comfortable
and
stretch.
you can hit different levels with this. I really should work the other direction, but I'm gonna hit my mic when I do that. So-
I needed that too, but yeah,
we're
if
in
you got-
trouble.
if you're wearing a mic, you only can go one
Yeah,
direction.
you only go the one direction, so, again, you can do a good set of 10. You can do it a couple times a day if you want. I mean, you can
Oh,
do it
right.
more than that.
I usually say 3 times a day.
Sure,
To-
there you got it.
Sometimes I'll say 4 or 5 because I know they only get 3.
So look at that already.
Oh, I just felt a nice little pop in
Yeah,
there.
you're already moving
Felt
further,
good.
Brad.
Oh yeah.
I mean, yeah, you were like right here.
It feels good too. I mean,
Yeah.
yeah.
So that's actually where I
I
started.
might have slept on that side that night. You know, that could easily get you
Absolutely,
tight.
that gets you all night long, you're in a bad position. So, next one's side bending. We're not gonna use the belt for this one now. With side bending, you're just gonna go ahead, good posture. I want you really good posture. I do not want you being forward like this. And then you're gonna almost do even a little bit of a chin tuck, and then you're gonna side bend. So again, a chin tuck is not going down, it's not going up, it's just bringing the neck back, the head back.
It's like when I look at Bob's face, it makes me go, whoa, just kidding. Yeah, anyways, go on.
And you're a beauty to look at, Brad. And now, right, this marks the moment where the partners turn on each other.
Yeah.
All right, chin tuck, and I'm gonna go to the side, trying to put the ear to the shoulder. You can lightly take your fingertips and give a little bit of stretch.
And this is gently, like you
Yeah.
said, fingertips, we're not grabbing the head and pulling on it, it's just gentle.
Now this is actually one I do quite often, because
Sure.
I tend to, when I do my notes, I'm like this. So I often work on the other, so I'm tight this direction, so I'll do a chin tuck, and I'll go to the right. Chin tuck, and I'll go to the right. And I'll do those throughout the day, and, because if I get neck pain, that's what's causing it, is me being this way all day long.
And that's why, we went through the whole process of showing you how to check your range of motion, because there's probably certain ways that you want to emphasize like Bob does.
Yeah, repetitions, not quick stretches, they're not trying to crack your neck, we're just
Right.
trying to go ahead and give it a stretch.
Yep, nice and relaxed.
Remember, Brad and I can fix just about anything,
Except,
a broken heart.
there you go,
But we're working on it.
and we'll never stop. Well, once we get it figured out, we'll stop.
Yeah, that's a good time to
Yeah,
stop.
and then
On top.
then we'll get it patented.
All right, excellent.